It's cold and flu season, and I wanted to share with you some ways you can help keep yourself and your family healthy this winter. Hi, my name is Carol Bohm, and I'm a family nurse practitioner at Calvert Primary Care in Solomons. I've been caring for patients for over 20 years as a nurse practitioner, and believe me, I have seen lots of colds and flu. As a primary care provider, it's important to me to stay healthy so that I can treat my patients. And the tips that I am about to give you are ones that I practice every day. Both colds and flu are viral infections. You can catch them by coming into contact with someone or something that has come in contact with the virus. People often wonder whether what they have is a simple cold or the more serious flu, and here's how to tell. Colds generally start as a scratchy or sore throat, followed by coughing or sneezing, or they can start with a sneeze, quickly followed by a runny nose. Often a low-grade fever will follow. With a cold, you will rarely have an upset stomach, and colds usually increase in intensity over a few days, and then the symptoms will start to recede. The flu is usually more obvious. It hits quickly and often out of the blue and generally comes with body aches and fever. Fever is sometimes as high as 103 to 104, sometimes a stuffy nose and sore throat. The flu can also come with an upset stomach. One way to avoid the flu is to avoid coming into contact with anyone who has the flu, which is relatively difficult considering when you're out grocery shopping or at Walmart or Target, you are not aware of who has the flu that you may pass by. But since the flu virus can stay alive on hard surfaces for up to 24 hours, a person can be carrying the virus before they show any symptoms, and you may not know who has the flu until it's too late. So honestly, the best way to avoid getting the flu is to get a flu shot. Early indications are that this year's flu vaccine is very effective against most strains of the virus that you might encounter, including the strain that was not in the influenza vaccine last year. And it's important to remember that if you get the shot and still come down with the flu, it will often be shorter in duration and less severe than if you had not gotten the flu shot. Here are some other things to do to avoid getting sick this winter. The first thing is to get enough sleep. A recent study showed that getting enough sleep, 7 to 9 hours a night, was as important as hand washing in reducing the risk of getting a cold or virus. Second, we should always practice good hand hygiene. Cold and flu germs are transmitted from person to person, either through direct or indirect contact, meaning an infected person touches you or touches a surface that you later then touch. Flu and cold viruses can survive on hard surfaces for up to 24 hours. That's why it's so important to wash your hands often. If you touch a door handle or a telephone or a shopping cart or a remote control at home, you may be picking up the cold or flu virus, so wash your hands often. I will show you the proper hand washing technique at the end of this video. The third one is to resist the urge to touch your face, your eyes, nose, mouth. Those are the fastest ways for viruses to enter your body, through the soft tissue and the mucous membranes. If your eye itches and you absolutely must scratch it, please remember to wash your hands first. Hand sanitizer, when to use it, when not to use it. Hand sanitizer is great. It does have substances in it that do kill bacteria and viruses, but it can be overused and dry your skin, causing cracks in your skin, making an avenue for viruses and bacteria to get into your system, thus making you sick. So we have times that hand sanitizer is necessarily useful, like when we travel or when we are not places where we can wash our hands with soap and water. So what do you do if you get a cold or the flu? First of all, be sure to take the right medications. People often come into my office with a cold or the flu and ask for antibiotics, and they tend to get upset when I don't prescribe them. That's because colds and the flu are viral infections which are not treatable with antibiotics. Antibiotics are used to treat bacterial infections such as strep throat, whooping cough, and UTIs. We tend to overuse antibiotics inappropriately in this country because we think they are going to make us feel better. Unfortunately, repeated use of antibiotics can result in the antibiotics becoming less and less effective as the bacteria learn how to adapt to them. In other words, the bacteria puts on a raincoat so that the next time you take that medicine's not going to work. To treat the flu, I can prescribe an antiviral medication such as Tamiflu or Valenza. Antivirals are usually prescribed for 5 days, although people hospitalized with the flu may need the medicine for longer than 5 days. And of course, you can make an appointment to see your primary care provider. At Calvert Primary Care, we always make room for same-day sick appointments. We want you to feel better as much as you want to feel better.